Americans are busier than ever, and the sandwich generation is taking care of their children as well as aging family members. This can cause many of them to overlook their own health care needs, and that is the case with this viewer.
My name is Hillary. I have 3 young kids and a newborn baby. I work from home, and I also take care of my wheelchair-bound aunt who had a brain aneurysm 3 years ago. She has to take 5 different medications, and they can be hard for me to keep track of. On top of that, I have my own health issues. I'm supposed to take medication twice daily. Because I'm so busy, it can be hard for me to remember to take them when I'm supposed to. I know I have to stay healthy, not only for myself, but for my family, but I'm so overwhelmed. Is this a common problem other people also face? Because I'd really love to know.
Our good friend and colleague, Dr. Frida Lewis Hall, the Chief Medical Officer of Pfizer, is back. And, you know, Hillary's situation, just one example of how difficult it can be to adhere to medication schedules for yourself or maybe someone else.
Absolutely, and especially if you're dealing with multiple medications. And, you know, as we get older, we tend to need more medications. You know, many people 65 and older are managing multiple chronic conditions, and about 12% of them take 10 medicines or more per week. And this can also contribute to medication errors.
That's a really good point. Tom Mennigan, CEO of the American Pharmacists Association, is here to talk about managing that risk. And Tom, I want to ask you, what advice do you have for those picking up or taking multiple medications?
Many pharmacies today can enroll patients in medication synchronization programs to simplify their refills. So they or a caregiver can pick up all their medicines at a single visit at the pharmacy. Think of it as one-stop shopping. To find a pharmacy in your area, you can go to simplysync.net, where you can find pharmacies to synchronize your medications.
And Frida, aside from convenience, how else are synchronization programs helping patients?
Well, you know, a recent study actually found that working with your pharmacist in this model can not only help improve your adherence, which is great, but it can also reduce hospitalizations, emergency room visits, and doctor's visits. So having your prescriptions filled at the same pharmacy can really help alert the pharmacist that a new medication or a change in medication could lead to an interaction or some other problem. But if you can't use one pharmacy all the time, there are a few things that you can do. First of all, every time you go, you should take a list of all of your medications, prescription and over the counter. And you want to give that to each of the pharmacists every time you go.
And Tom, I want to ask you, why is it so important to work with your pharmacist?
Yeah, well, developing a relationship with your pharmacist can help prevent medication issues and can help you get the most out of all the medicines that you do take. You can talk to us about your medications. You can talk about what vaccinations may be due, and we can even help you quit smoking.
In addition to working with your pharmacist, here's some simple steps you can take to deal with multiple medications. Set reminders when to take medications. Check your expiration dates. Schedule regular appointments with your doctors and pharmacists to make sure medications are up to date. Tell your doctors and pharmacists if you're taking over-the-counter drugs or natural supplements. And if you have multiple healthcare providers, bring all your medications to every appointment.
There are also some do nots, right? The first is do not stop your medication without consulting with your healthcare team. And do not take medication that belongs to someone else. We have much more information on this subject on gethealthystayhealthy.com. And of course, while you're there, you can sign up for our monthly newsletter.
Dr. Frida, Tom, thank you so much for being with us here today.